Welcome to Phoenix Rising with Dr. Z. This podcast is all about conversations about healing and rising from the ashes of your grief and trauma. I'm your host, Dr. Christina Zampitella. It is my sincere hope that this podcast is going to give you the words and the understanding to help you heal through your grief and trauma. Hello, and welcome to my subscribers and my viewers, and maybe even first-time listeners. Thank you, and welcome to Phoenix Rising with Dr. Z. So I've been gone, right, for about a year and a half. For those of you who have been following me, you probably noticed that a lot of the recordings ended about December of 2023, somewhere in that area. Well, lots happened in the last year and a half, and I was just going to go ahead and use this first episode to share with you a little bit of my story and tell you a little bit about what we can expect in future episodes. So about December 2023, December, I think, anyway, mid-December, I got a knee replacement. So I knew that was coming, not fun, losing a bit of my mobility for a while, wasn't going to like that very much, but whatever, I was sick of being in pain. But 4 days later, I get asked to come back into the hospital and was told, we're sorry, you've got leukemia. Leukemia, like out of the blue. And I just thought I was burnout. I was really, really tired at the middle of every afternoon for about 3 or 4 weeks, and come to find out, leukemia. I was also told that had I not come in, I would have died within about 2 to 4 weeks. So I go to the orthopedic guy. Anyway, just tell you a little bit about the story, which is what I want to do in this first episode, so you know exactly what happened, and then maybe get a little bit of insight about what's been holding up the drops of the episodes. So I go to the hospital. They send me directly to the hospital, put me in a waiting room. It's at UPenn, which is one of the most renowned places for the treatment of leukemia. This I didn't know. I mean, like complete shock. I'm like, this cannot be real. There's no way. I don't even understand where this came from. It's not in my family. Cancer doesn't run in my family. So, but anyway, I'm in the waiting room for 12 hours because that's our medical system now, and get sent up to one of the floors where all the cancer patients were. And no clothes, no toothbrush, no nothing, get put into this room, sweet ass room, but about a month not being able to leave the unit. Getting chemo almost every single day, getting woken up every 4 hours, getting my temperature taken and my blood pressure, and being given more meds, and getting really sick, and them trying to figure out it was freaking hell. It was nothing like I anticipated. You hear other people who have had cancer, you find out that they go in, maybe get the radiation. So I knew nothing about treatment of blood cancers versus what they call hard cancers, which these are all things we're definitely going to be talking about in the future episodes of Phoenix Rising. So I'm in there 30 days. I lose 30 pounds, and not in a way that any person would want to lose 30 pounds, because most of it was like muscle, and I looked sick. I lost all my hair, which I've got to say, as a woman, in our culture, probably in most cultures, but women in our culture really have a lot of pressure to have long, thick, beautiful hair. And I had longer hair. I hated having to straighten it all the time, but nonetheless, I had long hair. And I remember standing in the bathroom at the hospital with clumps of my hair falling out. And nobody was there. None of my family was there when this was happening. And I was sobbing. And if it weren't for the nurses on that unit, honest to God, I have no idea how the hell I would have gotten through that month and getting so sick. Um, and here's the thing, I went into remission a good like 3 weeks into being there. So you have leukemia, but you don't have leukemia, you're in remission. So do you, you have chemo. Basically, you have chemo. So I get out after 30 days. There's other kinds of complications. My body does not like I don't know anybody's body who likes seven poison dumped in them. I just was fighting. I was fighting for my life. And I mean, I couldn't see my clients. I had to tell each one of my clients because what was I going to show up to work, with, I wasn't going to wear a wig. They're itchy and hot, by the way, if you haven't had to experience that. So I'm wearing, scarves on my head and lost all that weight and I looked like shit. So obviously they were going to know. Not to mention they needed to be continue to be treated. So I needed to make sure that they got the help that they needed by perhaps going to other, people. Um, Not many people did that. A lot of them wanted to wait. They wanted, they said, if you feel good 1 week, just let me know. If you need to cancel at the last minute, if you want to do telehealth, it's like, I really truly appreciated that, and I went with it if that's what they wanted to do. So those first 30 days, I couldn't have done that without my support system. I mean, it was over Christmas. It was over all, those holidays. My friends came in and decorated my room. My husband would come up all the time, but it's an hour away from my house. So, and nobody was telling me anything. Social workers weren't coming in and really explaining what was going on. All I know is like I was on a unit and I was watching people like be taken out on hospital beds and they had died. And I thought I was going to die. Nobody's telling me anything. So I'm like, oh my God, like I have to update my will. I have to figure out what I'm going to do with my business. What about my podcast? What about my practice? What about my presenting everywhere? What about my family? Most importantly, what about my family? Um, and finally, like a social worker, she comes in and I'm like sobbing and I'm trying to explain to her, like, how am I going to get this done? And she's like, why are you thinking that? I'm like, because I got like, I don't know, 6 months. Nobody's talking to me about it. And she's like, what makes you say that? So I tell her, I'm watching people get taken out on beds who are passed away. And she goes, yeah, but you're on this unit because the floor above you where all the leukemia patients are, there were no beds there. When the hell were you getting ready to tell me that? When were you going to tell me? So I think they're so used to treating people that they make, I don't know, maybe make some assumptions. So I was not, I was pissed to the highest of festivity at that point. So I mean, you have all the emotions, right? And I've got my husband has to take FMLA in order to come up and see me and not lose his job. The kids are coming up, they don't know what's going on. My three teenage stepsons, also known as the Delaware Wrecking Crew. Um, I'm worried about my cats and my dog, which that's a lot of stuff to take care of. And I wasn't allowed to do a whole lot of stuff. So I get out of the hospital after they explained everything, right? They explained everything to me. Here's some resources, blah, blah, blah. I go out of the hospital. I have some complications, go back into the hospital like 3 or 4 days later. I'm back out of the hospital. At this point, my birthday's rolling around on February 1st, and I'll be hot damned if I'm going to be in the hospital on my birthday. And they wanted to keep me around because I tripped over the bottom of my pajama bottoms, and then they called me not a flight risk. It might have been a flight risk. I was a fall risk, which, by the way, if you've never been in the hospital and been a fall risk or seen anybody be a fall risk, when you lay in the bed, which you are most of the time in the bed or in this chair that they have in the room, if you move off of it, a freaking alarm goes off and like everybody swarms into your room because they thought you fell out, which is smart thing to have. But I did not need that. But anyway, at that point, I was just like, you know what, I'm out. AMA, against medical advice. That's it. I can't do this anymore. So um, they talk to me, we come up with a plan. There's some back and forth with different oncologists there, about who, because they work in teams. So they were back and forth about what their decision was. And eventually they're like, okay, you can go out, look for these, signs, but, and we'll see you on Monday. So back and forth to the hospital every day. And you're there for hours. Oh, and all of this. Here's something fun. You're getting lumbar punctures along the way. So they go in, they pull cerebral spinal fluid out of your spine, and then they push in more chemo. And that hurts, in case you're wondering. And then I'm getting drilled into my hip in order to get bone marrow to check to see what's going on with my bone marrow. All of this I'm going through and I'm fighting because I understand why it's happening. I have and had the most amazing oncologist. She is a specialist in my kind of leukemia, which, by the way, if you don't know this already, there's tons of different kinds of leukemias in and upon themselves. So, we'll fast forward a little bit because I could keep going and on. I think what I'll do is end up doing an episode on, well, I will. I'll be doing episodes on cancers and other kinds of losses. But anyway, fast forward a couple of months, my freaking dog dies. Kaya was the therapy dog, meaning she actually used to come to my practice and like basically round up people from the waiting room and bring them into my office. And she was a therapy dog. So she dies. All this time, chemo, pills, I mean, handfuls of pills. I still take handfuls of pills, but handfuls of pills. I can't do half the things that I want to do in order to cope. One of the things I like to do a lot is garden. Well, guess what you can't do when you have cancer and you've been, taking chemo and you have really low counts of the cells in your body that fight infections. You can't do gardening because there are bacteria in the soil. Never even occurred to me. So many things. And I grieve over and over again. Just you grieve the future. You grieve the past that you had. I grieved the past that I had. I grieved who I was before. Anyway, your health and etc. But anyway, I'm going to continue to tell this kind of story so you know where the hell I've been. I try to get through the summer, still getting sick. They change your protocol as you're moving along, as you're responding to it. You're getting blood work. You're having a nurse come to your house. I had a nurse. I'm saying I don't know what happened for those of you who might have gone through this or had a loved one who have gone through this, but there'd be a nurse that would come to my house twice a week, and she would take blood. I had a line, this thing that they had put into my arm that I had to wrap around my arm in between in order to take a shower. I had to cover it up, and they would use that in order to get the blood out. I didn't even have a port until later on in the year. A port is the thing that right here, where they put it in your chest. So trying to get through the summer, it's miserable. I'm trying to rehab my knee. I am back and forth, like I said, with the hospital, trying to go back to work, started seeing clients again. I'm not presenting at this point. I'm not doing the podcast. I mean, at this point, throughout the summer, I was bald. So I was really self-conscious. I tried to do like cute little things, with my, scarves, but you can only go so far. And fast forward to August of 2024. And on August 18th, I get a call. My father had fallen down the stairs. They did not live around the corner. They lived in the Midwest. So my father fell down the stairs and he passed away. So I fly out. I want to fly out. My doctor's like, your numbers are really low. And I'm like, I'm going to fly out to go be with my mom. And she goes, do you want to die? I'm like, are you freaking kidding me right now? She's like, you need a transfusion. So before I could even fly out to go see my mom and to be and to help and try to grieve with her because it's just me and her. Um, I'm having to get a transfusion, and I just in absolute freaking disbelief. I'm just shaking my head like this is a country song. This is freaking awful. So I stay there a week, and we'll talk about the loss of a parent at some point in a future episode because I that's this is a whole different ballgame. A week later, so I'm out there on August 26th. I had left my mom on the 25th. And in the early mornings of the 26th, I get a call. Um, and that's a whole traumatic event about what happened. And, like I said, we'll get into, we have a lot of time because I'm damn sure we have a lot of time. My mom died. So I lost my mom and my dad within a week of each other while fighting cancer, grieving my dog, and all the losses that go along with all of this, the losses of the way I understood my career, the way I understand who I was in the world, the way I understood the world in general. And then, you know, lumbar punctures and more chemo and just lots of different pivots in my treatment due to not reacting really well to immunotherapy and all this other stuff. Finally, October 1st, I am put into maintenance, which is like you're in maintenance for several years before you have to hit the 5-year mark to be considered cured. I do have the kind of leukemia that is curable. It's highly curable. Um, so I'll be continuing to fight that. I do know that when she said, "Oh yeah, you're still going to be taking having chemo," and I'm like, the first thing is, am I going to feel like shit indefinitely? And the second one, am I going to lose my hair again? I mean, this is like a thing. This was like a whole thing. And in terms of what it was like to see the fuzz come back, and then what they call like chemo curl, and then the texture of your hair changes, and you just hear story after story, and then finally starting to connect with other people who had loved ones that were fighting their own battles, were having themselves navigating their own rocky waters of their battles. And this whole time, the impact it's having on so many different domains of my life and trying to figure out how the hell I'm pretty sure I finished Netflix and I was about halfway through Hulu before I had the ability to like get up and actually start doing things. Because you're exhausted, you're just wiped out. They're shoving, they're shoving poison into your body, and there's something about that, about not wanting to take it because it makes you feel like shit, but at the same time, knowing that you need to fight, and this is so much of what the fight is about. Okay. So year's been going on. Half of it I'm numb. I recognized it. I recognized the grieving process. I recognized the trauma of it all. I didn't, I knew it like intellectually. I also knew it personally. I've been through enough freaking losses before. If you've watched my first couple of episodes, you know my story. So I have had my own experience. So it wasn't just like intellectualized, it was actually understood emotionally. You can understand it, but going through it, at least at least I had an idea that what I was experiencing was normal, that I could speak about it. I didn't have to shut up about it. Even if people were uncomfortable about it, not my problem, your problem kind of thing. Um, and then came Christmas. Christmas was really freaking hard. The holidays were hard. And time just kept going by. And I just kept grieving and my hair continued to grow and my numbers continued to get stable. And finally, we get to 2025 and I'm like, 2024 can suck it. I am over it. 2025 is going to be better. That's it. There's no way. But 2024 will go down as the worst year in my life thus far. And let's hope it stays that way because it's done. So 2025 has been interesting. There's been moments of complete deep sorrow. The depths of the darkness can get really overwhelming. But I do know, and I do say this to myself, this too shall pass. This too shall pass. It's like my mantra. This too shall pass. And I always thought mantras are kind of like hit or miss with some people. No, that one works for me. This too shall pass. And I even say that to myself with good times. This too shall pass. Trying not to get too attached to any one thing so that I'm not blindsided when at least I can say, well, I knew that was going to pass. And then when a bad thing starts to become a little bit easier, the bad thing was going to pass. So that is like the new thing I say. This too shall pass. Not new. That's what I've been saying to myself. So back to clinical work. Thank God the people that have been in my life. We are now, right now, at the end of July of 2025. And I want to tell you a little bit about what has made it possible for me to get to where I am now. The very first thing I can say is my social support. If it hadn't been for my husband, my family, my friends, my therapist, my doctors, I mean, the people that work for me and with me, I there's no way I would have gotten through this. If you've shut yourself down from your support system because you've had your own losses and you don't feel like people can understand, find people who can. Don't quiet your voice in order to make other people feel more comfortable. We can explore some of the ways of doing that in a future episode. I'm just trying to give you an update about what's been going on so that you can see where we're headed. So the second thing I can say is feel the feels and think what you need to think and allow yourself to do grief your way. You own your grief. You are your own expert. Even as a person who specializes in working with people with grief and trauma, I will never ever say, I know exactly how you feel. I don't know exactly how you feel. I don't. I can relate to it. I will walk next to you. I will fight with you. We will explore your strengths. We will figure out how to move forward while life is blown up and you're trying to figure out who the hell you are now. We will try to make meaning from what you've gone through. You might be really, really far away from being able to say, you know what? Had I not gone through this, I never would have this. Don't even worry about it. If you're nowhere near that's okay. It's okay. Hopefully there'll be a time where you integrate your grief. And if you're not, I think take a look at the episode on prolonged grief disorder, because grief is not a disorder. Trauma itself is not a disorder. Those are experiences. Those are normative. We're going to get through life. You're not going to get through life unscathed, right? How you navigate those new places, those dark places in your heart, the deprivation you might feel, the and gosh, there's so many different ways that you can experience loss, but the way you navigate those, well, that's unique to you. And it's okay to not be okay. There are going to be certain losses that are going to be easier to navigate than others. So you might be able to identify what your losses are, but just keep in mind that new losses will rip the wounds open from previous losses. That's very normal as well. So where we're headed. I didn't get to do a whole lot of episodes that I wanted to do before I had to pause. And I had listeners reaching out to me, sending me emails, posting on YouTube, posting on TikTok. There's been thousands and thousands of views on TikTok. I've got hundreds of subscribers on YouTube. I've had oh, so many downloads on like Spotify and Apple and etc. Um, asking me, when are you going to talk about this? When are you going to talk about that? I'd like to see an episode on this. Well, that's my goal. First off, if you are watching this on some kind of platform where you're able to make a comment, type in the comment a topic you would like covered in the podcast. Please, by all means, would love to hear your ideas. You know, if you I think one of the topics that we didn't never had a chance to get to, I said it earlier, was let's talk about the loss of a parent. Let's talk about a loss of a sibling. What about a loss of a sibling at different times in our lives? Let's talk about homicide. Let's talk about chronic illness. Talk about cancer. There's so many topics. Loss of independence as you're getting older. What it's like to be a family caregiver and how to navigate that process without giving up your entire life and trying to find like how do you identify as a caregiver? Like there's so many dynamics of caregiving. And I'm trying to, you probably tell I don't want to get too far off any one topic because there's so many other things that we want to explore in future episodes. So what I can say, the goal here is for us to continue to explore, understand, examine, assess, weave in topics, experiences, different kinds of traumas, different kinds of losses, and how do we rise from the ashes of those losses? How do we become a phoenix? Does it even seem possible that we can do that? Is the grief so intense and consuming? Is the trauma so intense and consuming that you can't even conceptualize that life can, like, there can be a new normal? And what the hell is that going to look like? I don't want there to be a normal without this person in my life. You have no choice. So what do we do? What is normal? But what is healthy and normal? How do we get there? I'm going to interview people. I'm going to interview not only professionals in the field. The podcast is going to be a little bit of a shift. I'm not going to focus only on professionals. I really want to bring people in who want to talk about their own experience. I want to bring people in who want to share their story, who want to share their narrative, to express and help other people understand how to find a sense of, I want to say, acceptance of the reality of whatever that loss is. There are not 5 stages of grief, by the way, which is an episode. I've probably said that in 90 different episodes. But what does this look like, and what has been helpful? So another thing you can do is, if you want, you can go onto the landing page from the centerforgrieftherapy.com, which is the name of my group practice, centerforgrieftherapy.com. And you can go on to the Phoenix Rising with Dr. Z page and request to become a guest on the podcast. And you can do that via Zoom, and you can also do it in person. I would love to have you. I am very curious of your ideas. And if you are watching this, like I said, if you're watching this, for example, on like a reel of this on TikTok, click the link, become a subscriber, go ahead and enjoy examining the topic that you're interested in looking at, and then follow this. This is going to be a journey. It's going to be continued to be a journey for myself. It's definitely going to be a journey for the people who are followers of the podcast. And I hope that we find topics that you're really interested in, and ones that people aren't talking about. All right. So thank you. Thank you for watching this. Thank you for your patience in waiting for the new episodes to drop. Thank you for your understanding and all your support. And just remember, don't be afraid to rise. All right? Okay. See you soon.
Thanks for listening to Phoenix Rising with Dr. Z. If this episode helped, subscribe and share it with someone who needs it. We'll see you next time.